Hello, everyone. I'm Rebecca Emerson, and welcome to EFM's Facebook Live with National Guard and Reserve Military Spouse of the Year winners. I just want to set the stage briefly and talk about what EFMP is, right? For those of you who may not know what it is a program designed by DoD to help families who have special needs or family members who seek specialty care or have routine specialty care. There are kind of three different sides to EFMP. There's a medical side, it's just like what TRICARE covers, and there's also family services, so think Fleet and Family, ACS, and they often do programs that help family members with EFMP, like support groups and things like that. Also, each branch of service has programmatic rules, and those can cover a variety of different things, such as each branch of service has their own respite care that is designed to help families navigate through their special medical needs or special education needs as well. So both of those are qualifiers for the EFMP program. And I just want to briefly explain AFI's Military Spouse of the Year program. It's a great program. We're all winners here. And nominations just closed down, but it happens every year. So if you missed it, you can go next year. And it's a great way to connect with other advocates, connect with other spouses, and really share a community or be in a community of spouses that are passionate about various platforms. So the point of this Facebook Live is for families to share their experiences with EFMP within the Guard and Reserve specifically with the AFI MSOY winners. Because there are some challenges out there, and sharing our experiences will help arm the MSOY branch winners and anybody watching with an inside look of what EFMP challenges look like within the Guard and Reserve. And this video, you can share it with anybody you want, leadership or legislators, anybody that you want to share it with, because we're ready to share the experiences. So I'm just going to go through some introductions. I'll go first. My name is Rebecca. I am not Guard and Reserve. I am active duty spouse and also retired Air Force. Our child, Winston, was born with Down syndrome, and that is what brought us into this world. But I will kick it off for introductions. And Carolyn, will you go first, please?
Yeah, hi, my name is Carolyn Chase. I am the 2020-2021 California National Guard Military Spouse of the Year. I'm also the AFI 2022 Florida National Guard Military Spouse of the Year. It's hard to say that. I have 4 children, and 2 of them are exceptional needs, and I began advocating for families with exceptional needs when my daughter was born. She's my youngest. She was born with Down syndrome and is also legally blind. My youngest son is autistic and has numerous medical conditions like allergies, and he was born premature, so he has smaller physical statures in his nose and ears and mouth, and has required multiple surgeries over the year. And so we've been a Guard family for over 20 something years. And I have only within the last 5 years even heard about the EFMP. So I don't know if you're going to continue with introductions for everybody, or if you just want me to jump right in. You tell me.
Let's do some introductions real quick so people know who we are. Julie, could you go next?
Hi, I'm Julie Eshelman. I'm the 2019 AFI Unattached Army Spouse of the Year and the 2022 AFI Fort Leavenworth Spouse of the Year. We are a Army Reserve family, and we are currently stationed in Schuylkill Haven, Pennsylvania. I dare you to try and spell that.
Cindy, can you go?
Hi, everybody. Thanks, Rebecca, for inviting me. I am the 2022 National Guard Spouse of the Year, previously 2020, 2021 New York National Guard Spouse of the Year. I advocate for our National Guard, pretty much all of it. I started with spouse underemployment, but it really all connects. And after meeting Carolyn in 2021 and hearing her story, really opened my eyes to everything that you guys go through and the challenges. I didn't really know about the EFMP before, but I'm also a 30-year military spouse, previously active duty, transitioning into active Guard and Reserve. So nothing really changed for me. Except not having those resources in the community. So that's who I am and a little bit about what I do, and really focusing on trying to bring light to who and what the National Guard is today. With AFI, Armed Forces Insurance, providing this platform for all of us to get to know each other, realizing that we're not in this alone, and that our voices can be heard and we can learn from each other. So like Rebecca said, the nominations closed, and I would really like to see the numbers up for next year. So we really need to do our part to elevate and amplify our National Guard voices.
Thank you, Cindy. Yes, and I wanted to add that sometimes, the award winners do get access to people and legislators and other conversations that not everybody gets access to. And just educating the winners on these issues can help them bring personal experiences and, relay personal experiences to the table that we may not have a seat at every day. Carolyn, I know you have a great story, and I just would like for you to start off with sharing your experience in the Guard trying to get access to EFMP.
Yeah, so like I said, my family, we were active duty. We went to the Guard and started building a family in the Fresno Air National Guard in California. And we were there for multiple years. Like I said, my son and daughter are both exceptional needs. And throughout our entire career in the Guard, and then eventually in the Reserve unit, and then back to the Guard, we have discovered the EFMP, the Exceptional Family Members Program. I'd like to add that we discovered it when my first exceptional needs child came along 17 years after he was born. 12 years after he was born, which is a shame because we could have benefited from this program for 12 years. And I think it highlights the fact that we have the number one issue in the Guard, which is a lack of communication and a lack of education. So I just wanted to share my story and why I feel this way, and also maybe share a little bit of what I feel we can do to address some of these problems, whether they're as simple as education or as complicated as changing legislation. So back in 2018, my husband was a technician. That's a Title 32 employee. We did not qualify for EFMP, not because of medical qualifications, but because of status qualifications. He had to be active duty or on orders. He got orders, though, for a 6-month deployment to Qatar, or Qatar, or however you want to pronounce it. And I knew that by that point, because my daughter was already born, and I knew we were going to have procedures coming up, I knew we were going to have surgeries coming up, I knew that I was already at my limit. Even though I dealt with deployment in the past and I'd taken care of 3-month deployments, easy peasy, and I was very experienced, I really felt like the 6-month stint with multiple children with exceptional needs was going to breach my limits. So I started researching, I started asking around. Now, I think it's important to note that at this time, I was already a key volunteer with the unit. So I was very familiar with family readiness. I was very familiar with our units. I knew the structure of the organization and who to go to. And even with all that knowledge, I still was not aware of this program, and I still was not aware of any other options I had other than local resources. So I started digging. I did find the Exceptional Family Members Program, and I did start the research on that by going to Family Readiness. Unfortunately, with the Family Readiness Office coordinator, she wasn't very familiar with EFMP. Not that she wasn't educated on what the program was, but she didn't really know how to enroll or who could enroll. And I think that's primarily based on the fact that no one else had ever asked her how to enroll or ever spoke with her about enrollment, uh, because nobody is knowing about the program and knows that the program exists. So she's rushing around trying to find answers for me. I'm rushing around trying to find answers. And really, there aren't very many places to go to find these answers. So I was handed a 3-inch 3-ring binder of information about what EFMP was. And still, I read it and I still was not able to find out answers for the guard and find out answers specifically on enrollment, on how to enroll. So we contacted the local Army Guard installation to ask them, how do you support your families? This Army Guard installation, similar. They did not know how to enroll. They knew of the program. They did not know who qualifies for the program. They did not know how to enroll in the program. So eventually we were transferred to the closest active duty installation, which was the Naval Air Station. Now, I am Air National Guard, not Navy. And but we were reaching out anyway. We thought this EFMP program is for every active duty installation, and it is, but we didn't know that the enrollment process was something that we needed to be affiliated with that particular branch of service. This confusion alone caused us several weeks of misinformation and delay in our enrollment process, which by this point we realized that while we could try to enroll, we couldn't officially put in enrollment paperwork until the start date of our orders. So I'm trying to get all this done before he's gone, just to make it easier on myself. However, that didn't happen. We did not find out who to talk to until after he was already deployed. And we did find that we needed to go to a active duty installation nearest to us that was affiliated with our branch of service. We called them, and unfortunately, they are specialists in EFMP, but not specialists in Guard. I was denied at first. I had put lots of pushback. So the pushback included things like, "You're Guard, and you don't have this available for service. You just don't qualify because you're Guard." Again, I was told I could. I cited sources, which I fortunately had because I'm an investigative parent, but I had to push back and say, "Oh no, I do have this." Then they said, "You're a Guard. Why would you want it? This is about relocation. This is about movement, and you guys aren't even moving. Why do you want it?" So I had to do a lot of explaining and a lot of educating on the EFMP to the EFMP specialists at the installation nearest to us, at the active duty installation. Eventually, we decided that I could enroll and started to enroll, but they had no idea. They were requiring me to come to their medical facility, which was at that time 270 miles away. And there was no way we were going to be able to do that to start this enrollment process with their provider. So we told them we are a remote location. We need to be able to do that. They allowed us to do it with our own service provider. But then they stopped the enrollment and said, "Hey, if all you want is TRICARE, or if all you want is respite care, you can get that through TRICARE. TRICARE Echo." And so they were trying to push me off into TRICARE Echo to kind of shorten this. So I called TRICARE and said, "Hey, I'd like to enroll in respite care," and was immediately told I can't enroll in respite care unless I am enrolled in EFMP. This endless loop of misinformation and pushing the buck. Frustration does not is not a good enough word to describe the level of aggravation at this point. And I'm dealing with this on my own while my husband's deployed, and I'm already at my wit's end with dealing with the challenges that come along with being an exceptional family. Long story short, TRICARE wasn't very helpful. And I just want to note that we only had TRICARE because we decided that we wanted to use it as a secondary insurance. But typically, Guard members, they're told, hey, listen, if unless you want to lose all of your providers, I would not enroll your family in TRICARE, because then you have to go find TRICARE providers, and you only get that provider for as long as your order date. So we were actually told to go ahead and maintain our private insurance and to continue paying out of pocket for our primary insurance. So I did have TRICARE because we decided we needed the supplemental insurance, but normally Guard families aren't doing that. They're keeping their private insurance so that those exceptional family members and those specialists that they're seeing, they don't lose them. So yeah, that's not necessarily an option to go through TRICARE. But I digress. So we ended up finding a way to enroll in EFMP, but it took 3 of those 6 months. So I finally wasn't able to enroll in EFMP. Now what? Where are these providers? Where's my respite care? So I called to find my respite care and was told there isn't any. Beale only knows about the respite care at Beale, and that's 200 and something miles away. If I want to find a respite care in my area, at that time, I had to call Child Care Aware and ask them. Well, Child Care Aware has their own enrollment process. So again, another hurdle, another paperwork, something else you have to do, which I was glad to do. I needed help. So I filled out all their paperwork just to be told, sorry, there's no providers in your area. The closest one is at that Navy installation that is 70 miles away. You don't have any providers in your area. So what do I do? How do I get a provider? Well, I was instructed I needed to not only recruit, but to enroll a provider. And that provider would get so many hours a month. And then that would end at the time of the end date of my orders. So through a miracle, I was able to find a provider willing to fill out all the background information. They also needed to have CPR, and I think it was, they had to have like 2 or 3 classes that they needed to do to qualify and to enroll in Child Care Aware. So first aid and CPR, they needed to do that. They needed to show proof of that, which meant they would have to pay it out of pocket. But I volunteered to pay that out of pocket, knowing I wouldn't get reimbursed for that, or thinking I wouldn't get reimbursed for that. So we finally did that. We turned in all the paperwork. Then we are told, hey, you can go ahead and get these services and we'll reimburse you when the paperwork goes through. Well, I decided not to do that. It didn't sound very safe. So luckily I did, because I got a call 2 weeks later saying the Air Force is no longer using Child Care Aware. They are no longer the service provider. And now you have to go through Air Force to enroll these people. And that requires a full background check. And that background check could take anywhere from a month to 3 months to go through. And your service provider has to be willing to go through this background check. Well, I was like 8 weeks into the end of the order date. I didn't feel like there was going to be any I had to go and first get all that information from her. She's already irritated that I had to get all the information and pay for classes that she wasn't sure she needed. And it didn't work out for us. It just didn't. Now, I'd like to go back to this whole ECHO thing, the TRICARE ECHO respite care, because when we moved here to Florida and we were put on AGR, active duty orders, we were thinking, let's make this shortcut, because we didn't take the shortcut the first time. Let's take this shortcut now. And that is that Guard members have a waiver that they can get TRICARE ECHO without enrolling in EFMP. So we thought, okay, well, let's get this shortcut while we're waiting to enroll in EFMP. Well, the shortcut, or the fix, this ECHO fix, wasn't really a fix at all. We found out very quickly that TRICARE has no actual method or way to enroll Guard members and their families into TRICARE Echo without enrolling them in EFMP first. I called several times. Each time there was pushback saying, no, you have to enroll in EFMP. I had to explain the waiver, had to be very assertive with it, and asked to speak to managers and asked to speak to other representatives. And each time that I called with a question, or each time I called to verify information, I was told different information. I was told, okay, you can enroll, but you have to give us all your EFMP paperwork directly. Well, that's just enrolling in EFMP. And if I'm going to do that, then I'm going to just enroll in EFMP. I was told that I had to send my entire medical history with a doctor's note to TRICARE and hope it gets denied so that I can, send in the referrals to all of my children's needs and hope they get denied so I can form an appeal and get TRICARE Echo started with a case manager for the appeal. That sounds like I don't want to do that. So I had to, then I was told I can initiate if I have my entire medical history of each of my children sent over to a very specific line, a fax line that was just for Echo. And I was supposed to put on there, this is for Echo case management without any specific person that I was going to go to. I was not given any kind of date or timeline of when these would be looked into or when I would hear back from them. I wasn't told how I would hear back from them or how I would be able to follow this through the process and make sure that I can follow my paperwork. I wasn't given any kind of direct contact or information so that I can make sure that my paperwork is getting looked at and treated thusly. So is it a fix? In my opinion, no. No, I don't feel like it's a fix. So long story short, I have 4 main things that prevent Guard and Reserve family members from actually using these programs. And the first is education. There is nobody educating people on EFMP or TRICARE Echo in the Guard and Reserve. There are no specialists. There's no centralized number. There's no number that is a Guard and Reserve specialist for EFMP out there. There's no education on the program. No one's aware of the program. Yeah, there's nobody out there. Number 2, there's no way to track families. You can be an EFMP family for years and years. I wasted 10 years of our military life with 3 separate deployments over 3 months long and never once knew that I could get assistance. Why is that? Well, that's because nobody knew I needed assistance. And I wasn't aware that I could self-identify. And even if I was aware that I could self-identify, I had to who? Who do I self-identify to, and who do I go to report this? And why would I know? Why would I go and self-identify if I don't understand the program or know that there's a program out there? Number 3, the enrollment process is extremely complicated. It is complicated because we are not active duty. We don't have the medical facilities on our base. We don't have these people that know to refer us to EFMP. We're not getting identified. We're not getting that information out. So we have to search it out ourselves, and we hit so many wrong turns, just one after another. And it takes forever. And you can only start at the start date of your order. So you have to do this alone. You have to do this without your significant other around. You have to do this while you're the sole caregiver. It's just so complicated. And then it all ends as soon as your order dates end. But let's just say you are AGR. You're still trying to do this stuff without information. You're still getting the wrong resources. You still don't have any experts in the field that can answer these questions. It's still just an elongated process where I'm hearing from multiple people that I'm talking to that it could take well over a year to get enrolled into programs like EFMP and TRICARE Echo. That's just ridiculous. And then lastly is the waiver for TRICARE Echo. If we just had a standardized method of actually doing that, if we could just talk with TRICARE and figure out a way that we can actually make this a usable fix, then it's a fix. But until then, it really isn't an option. It's just not an option that Guard and Reserve members have available to them because they're facing more obstacles in that than they are facing in EFMP. Because nobody at TRICARE is familiar with this waiver. So we're having to educate TRICARE on it, and they have no way of streamlining this for us. So that's pretty much it. And if I don't know if there's any questions out there or any comments, or if anybody else has experienced any of these things, you feel free to share it now, and I'd be happy to discuss it.
Thank you, Carolyn. I will add, when you go, I did drop the Echo link in there. When you go on it, it does say that exactly what Carolyn said, but there's appears to be a hyperlink for Garden Reserve, but there isn't one. It's not connected to anything. So it goes back to the endless loop of trying to find the information, trying to find the right process.
And
So thank you.
Yeah, I think just to add to that, it's not just an endless loop. You get told these quick and easy solutions and these quick and easy answers without any follow through. And I think that's the biggest disappointment, because they're telling you, oh, that's simple, just go here. Oh, that's simple, just go to Military One Source. Oh, that's simple, just go to EFMPME. And we've tried the EFMPME and we've tried the Military One Source. And again, those are built for active duty, and they're not built for Guard specific and Guard and Reserve specific. So I think those resources that they keep throwing at us, they're not very helpful at all. Not for us.
Thank you, Carolyn. Julie, did you want to share your experience as well with the EFMP?
Yeah, so I have been with my spouse pretty much since he joined the military and joined the Army Reserve in 2010. And we have been in all the different duty statuses that are possible for a reserve soldier to be in. My husband has been in it. He's been, your standard 2 weeks in the summer, 1 weekend a month. He's done that. He's been on ADOS orders. He's been on stateside mobilizations, and now we are in active Guard Reserve family on active duty. And I didn't learn or even hear about the EFMP program until partway through his deployment in 2018, when I was the family readiness group leader. And we had some families with special needs, and they were like, hey, my active duty friends, like, they mentioned this program, like, what is it? And, I started trying to find information on it and how they can utilize it. And like Carolyn said, we just kind of get this runaround, where one office is passing us to another office. And it's really frustrating and really, really hard as, that leader to help those families, because it's my job to connect them to the different resources. And when we don't have those resources or have anybody we can connect them to, it's really hard, because the way that Army Reserve units are different than the National Guard is, our higher units, like our battalions and our brigades and stuff, they're states away, so we don't have anybody in our state to even provide assistance to us. Well, I marched over, down the road to the National Guard base. Well, they couldn't help us. We went over to Luke Air Force Base. They couldn't help us because we're Army. And so there's just this constant loop of not being able to know who to go to. And then once we finally get those answers, those families jumped through hoops the whole deployment and never could take advantage of the respite care that they desperately needed, or any of those resources that the programs offered. And so there's definitely, like Carolyn said, there's this lack of, qualified or educated staff to support reserve families and Guard families that are identify or self-identify as EFMP. And so they know that there's this program, but they can't take advantage of it, and nobody can tell us how we can take advantage of it. And, then flash forward a year and a half later, my husband gets picked up for the AGR program. And while we are filling out all the paperwork to get started in that program, the Army identifies me as an EFMP family member, because I have a rare genetic disorder where I am required to see a kidney specialist on a yearly and bi-yearly basis to make sure that I don't make kidney stones. Because if you've ever had kidney stones, they're not fun. And that was the whole process. And I'm like, well, what's EFMP? What I thought EFMP was special needs, like, only, because that's most of the, things that you find online are for those families that have special needs kids and resources for them. There's nothing about EFMP being for adult dependents. And so I was like, wait, why am I in this? And so there was no information. They're like, oh, well, you can go here. Well, like Rebecca pointed out, sometimes those links for reserve and guard don't really work, and they don't take you to anything. And I've spent the last several years trying to figure out, what options do I have? What resources do I have? Because now that I have a daughter and I have to go to these long appointments that I can't take her to, and how can I attend all these medical appointments I need to attend when I can't take my daughter and we don't have any childcare available to us because we live in the mountains in a town of 5,000 where there's no childcare options, let alone, Army approved, childcare aware locations. There aren't any. And so for me, it's just, I feel like I'm lost in the shuffle as an Army Reserve EFMP family without any help. And whenever we, sometimes our closest duty stations to us are from our sister branches, and they can't ever really help us, which is a sad thing. And I think that's something that a lot of Guard and Reserve families find as, a friction point is when they are trying to get services, whether it's EFMP or other services or resources, they can't access them because that's not the right branch. And I find that really frustrating too. It's like, hey, we're the military. Let's just help the military families. And so I definitely agree with Carolyn's, kind of friction points and, things that need to be addressed moving forward. I think for our Guard and Reserve families, to be able to access those resources when they're eligible for them, and even what they can do when they're not on active duty orders. What resources are there as a military family? So thanks you for letting me kind of share some of my experiences, which were very similar to Carolyn's.
Yes, Julie, thank you so much for sharing your experiences. And I would like to add something about standardization. So EFMP, and I saw this because I was Air Force. My husband was Army and I was Air Force. We're dual military, and we're filling out the same Department of Defense form and then going through two different processes. And I immediately thought, well, this is strange or crazy. I don't know how else to explain it. But EFMP is supposed to standardize. And I think it would be great if there was an avenue to open it up, especially it's for everybody, really, for active duty too, for joint bases, to be able to have, the ability to go to another service. I think that would be very, very helpful. There is a DoD instruction that is covers EFMP, and it's being redone right now, and it should be out. I don't know when exactly, but it should be out this year. And it should address some of these standardization efforts along with branch respite for EFMP families. So right now it depends on what service you are, on what type, how many hours of respite you get, and what qualifies you for respite. So those are some changes that are coming down the pike. However, I would like to also add for TRICARE Echo respite, which is completely different, right? It's through TRICARE Echo. That language was passed in the NDAA that a couple years ago, actually, that required the hours for TRICARE Echo respite to be increased from 16 to 32, and Defense Health Agency has yet to implement that policy change. In a forum that I was in, they indicated that it would take, about 3 years to make that change. So there's a huge disconnect. I'm just pointing it out because there's a huge disconnect with what the families need. And, I've heard a lot about respite care. We're desperate for it, right? We really need it for various things. And when language is created legislatively, it can take a long time to change. And I don't know why that is. Maybe someone can explain that to me. Why can't you just cross out 16 and put 32? I don't know. And then for the standardization across the branches too, I'm hoping, and I don't have any insider knowledge at all, but I'm really hoping that they will address the adult issue, or at least provide an avenue to let adults go to their critical care appointments to access respite care as well. Which brings me to community resources. And I would like to hand it over to Cindy to kind of talk about community resources. And she also has some information to share with you about MIC3, which you might not even know what that is.
So I'm sitting here re-listening to Carolyn's story, and it just brings back everything that is frustrating about being a guard family. So you touched on education, like what we can't focus on what we can't do. Let's focus on what we can do, right? So the guard, as families, we can elevate and amplify our voices, our stories. And that is how change happens, because there is strength in numbers. So the only way that we're going to be able to elevate and fix these roundabout issues, because with everything you get that loop, right? Because the active duty component doesn't understand the guard. And I was a previous Air Force spouse. I didn't understand who and what the National Guard was until we're in the middle of it. And coming into a community that doesn't have a DoD installation, doesn't have all those things. And the Guard isn't what it used to be, right? The Guard isn't just primarily the 1 weekend a month, the 2 weeks a year. It's not. It's just not. So what we can do is educate our community on who and what the National Guard is, the experiences that we're having, the gaps in services that we're having, the legislation changes in verbiage of currently serving. I know, Julie, we were talking about that before, like currently serving. I know that's probably years down the line for TRICARE purposes and stuff, but if we start to use that currently serving, and what that means, and that means our families too. Our families are serving, and we need to get our military children and our adult EFMP, we need to get them access to those resources. And how can we do that? Streamlining the process too, right? Like why are we using different words to explain the same thing? Why are you doing, we just need to figure out to get people to understand who are making the laws and the regulations and all of that stuff. We need that voice. And then I have Joining Forces is the initiative through the White House. And we can join our community's resources. Let's figure out how we can, you have to get involved. Never in a million years did I think 5 years ago I was going to be on a platform where I'm advocating for legislative change. I never thought that's what I was going to be doing. However, that's where the need is. We need to figure out how we're going to take care of our families when they're gone, when they're, whatever the status is, Title 32, Title 5, Title 10, all those things. Not everybody understands those, but as a military family, a Guard family and Reserve family, we quickly figure out what all that means. In a community that doesn't have that base for us, a building to go to get it. Yes, we have our military family programs, but a lot of times what were the instructions that were given take 2 years to come down from the Air Force level. We need to be on the same equal footing as our Army or Air Force, and that process has to streamline both ways so that everybody understands, and we don't get that cyclical call here, call there, the bouncing back and forth, because we give up. And we don't like to say we give up as military spouses. I know that we don't give up, because we'll continue to keep pushing, but at some point the quality of life issue really needs to be addressed. And we talk about recruiting and retention. We need to focus on that. That's going to make things better. So with the Joining Forces, are you guys familiar with Joining Forces? That program is, there's the pillars. So basically it's take military family or military spouse employment, military children education, and entrepreneurship. And if you go on to joining forces, you can see what those pillars are. And Military Interstate Children's Compact Commission, which is the educational component for military kids. When we PCS'd from active duty to Guard, we hand carried our records, which you're allowed to do. And MIC-3 is just a standardized education. Like, the policies are there already enacted. It's just centralizing them. So every state, right? Because we move the National Guard necessarily doesn't move all the time, but we do move. We do PCS, and with that, we have all the requirements to enroll our kids. And what the MIC-3 does is centralizes everything. And in 2014, every state enacted it. So now there's the option. There's a task force too. The question is, should we add National Guard and Reserve to that? Because it focuses on the IEPs, the 504s, and like Carolyn was saying before, just the problem to transfer all that paperwork. Now you can do it with Quest. It's a online. You have the availability to do it online. So you need to contact your states, ask them why they haven't enacted the National Guard and Reserve in your state. My answer was in New York that it's not needed. National Guard, there's not enough National Guard or Reserve families for it to affect. I'm pretty sure that that's inaccurate. And where's the data from that? Like, who's tracking it? And it comes down to that's not being tracked. Our numbers aren't being tracked. And how can we fix that? So locally, what I'm doing is through the platform of educating who and what the National Guard is, and I was approached by a National Guard member who is deployed a lot. There's a few units here in New York that don't have they've got a federal mission, so they're pretty much gone a lot of the time. So their family was having some issues. So the school was very, very open to understanding what they could do to help support educational success in the children in their district. So we are having the MIC 101 training. They're flying somebody out to our area to give that training during a superintendent in service day. And then we're going to have our very first Purple Up Day for the school, right? So, and we're trying to formulate a way to track how many kids are in that school that are military connected. Because when you fill out the paperwork, it says active duty, right? So that everyone's like, well, I'm not active duty. Well, even if you're AGR title, so it needs to go to currently serving, or so that we can track that. And the only way we can do that is if the district you're in understands, or the state. Those people making the decisions for us need to understand. And it's just about having a conversation. I asked the question and they're like, well, wait, well, why would we need it? Right? Why do you need it? And I think, Carolyn, they ask you the same question. Well, why do you want it? Well, because it's needed. So they're on board to figure out how we can get this to work. And it does go back to communication. Not everybody talks to each other, and it's very frustrating. Legislation takes a long time. I never knew the ins and outs of it, and thanks to Heba and Sarah, the Space Force Spouse of the Year and the Air Force Spouse of the Year, thankfully, I mean, we have them to lean on. All of us have them to lean on all of their great access and knowledge that they have to help guide us to make these changes. So the joining forces, we need to get in with our community, find out what resources are available. Like, we should have a state MOU, if we have a Guard unit in our backyard, what can we do to help them, our families that are here? Can we have, if there's similar programs that are within our community for respite care, how can we make that work for our Guard families? how can we do that? It's not a big ask. I think that it's necessary. So those are some of the things that I'm working on. Big thing is go to the website that Rebecca linked on here. See if your state's approved or not. If they said they're not going to, I know Arkansas has changed their verbiage to include National Guard and Reserve. So that helps solidify the IEP 504 plans, making sure that they get that. And part of that component is the physical, social, and emotional health of our military kids. And that's huge right now. So get involved, contact your state, your local leadership, see, and people want to help. They just don't know how, right? Like I had no idea which direction I was going. And then when I roomed with Carolyn, you opened my eyes, and it's pretty amazing. Your family is absolutely amazing. So I can't say enough about the Military Spouse of the Year program. It's allowed all of us on the screen right here. We would have never run into each other's paths. There's no way. Now you're not going to separate us, and that goes through every branch. We all have that commonality of we want to take care of those who mean the most to us. So get involved and vote. Voting is coming up, so vote for your National Guard member, and hopefully we'll continue to keep doing good things.
Thank you, Cindy, especially with all of your advocacy this year. It's been amazing, and we are glad to know you as well. Definitely.
And I think too, when you hear that, I need a seat at the table to be heard. When you get that seat at the table, bring somebody with you, with Carolyn and Julie, and you, Rebecca. I bring up my advocacy point. It isn't necessarily EFMP, but it's my duty to make sure that I've got the seat at the table, that I elevate some other things that are going on. So when you get that chance, don't take it for granted, and do what you can, because we need to leave the Guard better than we found it. And I think we're on our way to do that. And we've got some really great leaders in DC that are listening and that want to elevate and get that equal access. And it's about that equal access.
Thank you, Cindy. You're absolutely right. And I did want to add just one of the initiatives that we worked on here at EFM to try to move forward the Guard and Reserve, basically issues and pain points was, we think it starts with counting, right? We requested a GAO report be conducted to quantify the number of families who are Guard and Reserve that could be enrolled if EFMP, if activated. So that way you know who to reach, right? Because right now you don't even know who to reach, and people are finding it out by chance. So we thought a good first step would be a GAO report. However, it did not make it into the NDAA. We were disappointed, and we are going to try again this year. But the services could do this on their own. You don't need the NDAA to do this. So if you're leadership and you're watching this, please, count these people, these families, so they can get information, step one. However, there was this statement that came out, and it directs the SecDef to brief HASC on the eligibility of reserve component members for such programs and to describe how eligible members may access these programs. And so this statement was put in there this year, and this, of course, includes the EFMP program. So know that this statement exists as a way, hopefully, for the services to find solutions to some of these issues that we have brought up. And we also have some, support groups. We have a Guard and Reserve support group, and we have branch-specific support groups at EFM where you can crowdsource for information. And I'll put that link here. And if you want to get more directly involved We do have a whole advocacy link where you can fill out a story form, and you can, connect with Carolyn and try to maybe beat on some doors yourself, right? And share your family story to your legislators. And we also have a petition. So lots of ways you can help if you want. And I just wanted to throw that out here on ways you can get your voice heard. And I will open it up for questions right now. We have about 10 more minutes left, and we did get some questions and comments ahead of time. So we did cover a lot of these already in here. So maybe we just ruminate on some of these, but I think it's important to share them. Okay. So we have this comment here. Give you a minute to read it. Carolyn or Julie, I don't know if you want to comment on this.
This hits home to me, especially with a situation where you are a Title 32 or a technician and you're put on again and off again orders. That means that you have to reapply for EFMP every single time. And you can't begin that process until the start date on your orders, when you're alone, when you need the help the most is when you're allowed to reach out for help, not preemptively. You're not given the opportunity to find answers or to begin that search before the person leaves. You have to begin your efforts the start date of your orders, which is, in my opinion, such an easy fix. I mean, you can start your actual service provider time on the start date of your orders and just allow us to enroll or begin the enrollment process. And anywhere from, like, I would say 3 months, 6 months prior to being put on orders, prior to enrollment. This would be just such a huge advantage, such a huge advantage. So yeah, I feel the same way. You are already struggling. You already need the help. You're already fighting daily with just basic management of your family. And then you're asked to go above and beyond. And like Cindy was saying, you want to get out there and you want to be a part of this community and you want to make your voice heard, but you're drowning in your own chaos and it's just hard enough to maintain your status quo of your healthy, happy, consistent lifestyle within your family. So yeah, putting on all these things like enrollment and then advocacy on top of that, it's near impossible. And I don't think we need to put our families through this much stress. It's an easy fix. We should just be able to, prior to, start the enrollment process.
Carolyn, did you just say consistent?
Yeah.
I had to laugh.
Consistent care and treatment. And I feel like our families need that. And yet we don't get it. And I know it's laughable because it's military, but
at some point we have to laugh or we're going to cry, right? Like we do. Like, so, but this is,
I mean, an easy fix is why, when we have the yellow ribbon events like pre-deployment or pre-mobilizations, and they have the PAOs there and they have all the other services there, getting people pre-enrolled and all that kind of stuff and helping them get set up for the deployment. Why isn't EFMP there to help get our families set up so that when the orders start, like it's such an easy thing? And that's
because we don't have EFMP specialists. We don't have, that's why EFMP isn't there, because there's nobody within the Guard and Reserve any installation.
And it's needed.
I think too, it starts with command leadership. If they aren't invested in their families, then this stuff isn't going to happen.
It's not even just invested. I think they have to be educated.
Yes, they have to know that you have to take care of your families. You have to take care of our families, and getting that knowledge out there, that component of our families need some assistance and they're drowning, and our Guard families are drowning at a quicker rate.
Yeah, that would just be so easy to just be able to go and start the enrollment process early, but really education is included in that, because again, like Rebecca said, if we don't quantify who needs the help, how many people need the help, we can't even begin to address the issues of education and enrollment until we know, who's out there, how many people this affects, what kind of readiness this will affect for families and for service members. All of this depends on the numbers, right?
And some of them don't even know that they need the assistance.
No,
right?
yeah, you don't
You're not
know,
gonna know.
you know, and then by then it's too late.
And you can't self-identify.
Right.
If you don't think you're going to get any assistance, why are you going to bring that up, right?
Right. If you don't know the program is there, even how are you going to know to ask for it? So yeah, I agree 100%.
Yeah, so I'm just going to share another comment here, and it just kind of echoes. This is some of the comments we get ahead of time, but consistency of care. So there you go, Carolyn. Because who does it hurt, right? It hurts the family members when you really, I mean, we're talking about real people here who have real medical concerns or special education concerns, and being yanked around is not helpful for them to progress through their care plan.
Yeah, you're going on and off orders for a lot of technicians, at least, or for your drill status guardsmen. You're going on and off of orders. You're going on and off of TRICARE. Finding service providers that not only take your TRICARE, but also take your private insurance is super important. And yet it's not something that people talk about. They just have to find out through trial and error that they should have had service providers that also take TRICARE from the beginning. Otherwise, you're losing providers, gaining your providers. You're losing services, you're gaining services. It's a yo-yo for sure. And it's just having to re-enroll in EFMP every single time. What a headache. What a headache that is.
All right, so we are closing up on our hour. We have a few minutes left. Does anyone want to provide any closing comments or any final thoughts before we sign off?
I'd like just to say thank you guys for sharing your stories, educating me on aspects that I knew were out there, but I really didn't have a face to it. Having a face in you guys being so involved and being willing to share your story with me, and to just keep doing what you're doing. If you're not doing anything because you think that it's not going to matter, know that it is. Know that you're not alone, and that we are a phone call away, we're a text away, and we're going to help however we can, in whatever capacity we can. So, Rebecca, thank you so much for allowing me to be in here with you. And I love you guys. I mean, you guys are, we just have to keep fighting the fight. Some days we don't want to. Some days, we want to. What is this all for? It's all for our families. So thank you.
Yeah, and thank you guys for having me on and allowing me to voice, my experiences as an Army Reserve spouse, and those of the, spouses in my community that, I've heard and seen their struggles firsthand, and to give voice to that, and for everything that you guys do as an organization in advocating for our Reserve and Guard communities. So thank you.
I just wanted to say that for all of you out there, that my story sounds familiar to your story, or my experience rings a lot of bells, and you're having similar situations. EFM has built in a committee for our voices to be heard, and you don't necessarily have to be a part of that committee. You don't have to be a volunteer, but you can, as simply as sharing your story and sharing your experiences with us, help in this cause. So even though you're already inundated with basic life and the challenges that come from being an exceptional family member, you can make a difference. You can join the support group and share your stories with newcomers who are experiencing these things for the first time, or you can share your stories with us, and it would really go a long way for congressmen and for legislation to hear how it is affecting you personally, how is it affecting you individually, because those are the stories that really get through. Those are the stories that really mean something when they can hear from a family about their specific needs not being met. So yeah, just reach out to us, or I think Rebecca's sharing the story form. And again, that can be anonymously. So if you're fearful about any kind of somebody reading it that maybe you don't want to have read it, we can have those stories taken anonymously as well. So yeah, reach out and join our group if you feel like this is something that you want to invest time in or would be beneficial for you.
Thank you, Carolyn. Thank you to all of you for being on this Facebook Live and uplifting our EFM voice. And I look forward to seeing everyone on future Facebook Lives. Thank you so much.